Good evening, health advocates. Tonight we're going to talk a little bit about the importance of B3 in pregnancy and in particular miscarriages. I put a post earlier this week about Professor Sally Dunwoody, who's done a clinical trial in Australia about the significance of miscarriages in relation to not enough B3 in women's diets. So what does this mean? I mean, obviously the research is in mice and it's very early days, but I think the media went a bit crazy with it and they said, oh my goodness, every woman trying to fall pregnant now must know their B3 status. Well guys, it's really hard to check B3, and often we might check your metabolites of B3, and we've been doing metabolites of B3 for years. Okay, so let's bring it all together. What this trial said is that mice who didn't get niacin, which is B3 in their diet, had far more miscarriages in their pregnancy. And they actually found this incidentally, or Professor Sally did, with the diet they were eating. So absolutely, if you're going to go away and take a message from this podcast and you're thinking of falling pregnant and having a healthy baby, then you absolutely got to look at your diet and make sure you've got the right amount of food with the important nutrients, and B3 or niacin would be one of those nutrients. So where do you get B3? Well, predominantly from meat sources. You get it from turkey and chicken breast and sardines and tuna, your seeds and nuts and cheeses. These are all abundant. We're going to put a picture soon with the food groups you can get your B3 on. However, let's look at some caveats. What if you've got excess weight on at the moment? What if you've got a bit of inflammation in your tummy? What if you've got IBS-like symptoms or gut issues? Then the absorption of these niacin or B3 gets hugely reduced, and this is one of the Bs that we know gets reduced significantly. Okay, so therefore, how do we know what dose is right for you? Well, I'm going to give you the average standard dose for a woman between 10 and 14 milligrams a day. Now, if I'm trying to, and this is where the issue starts, when we look at the dosing, a lot of the multiminerals for pregnancy, this is the one I like, and you'll read the package and it'll say take between 1 and 3 capsules a day. Well guys, depending on your weight, if you have a healthy weight, you need a minimum of 2 capsules a day just to get over 10 milligrams. If you're overweight or you've got IBS categories or issues, you're going to be taking 3 capsules a day. So read your labels if you take a multimineral when you're pregnant, and you have to look at the dosing you're getting and look at you as an individual. Okay. We've known about B3 for years. We've used it for lowering cholesterol. Yep, it lowers cholesterol. We've used it for sugar stability. We used it for energy making. We've used it for depression, for over-methylating patients in depressed, sad states. Now we have a whole new area where B3 comes in. And the reason why it's now worked in fertility, they believe, because of the thing it makes. The first, or one of the most active metabolites of B3 is niacin adenosyl dinucleotide, NAD. So the question is, and this is what Professor Sally put out at the end of the clinical trial, shouldn't we be just testing the NAD level in people? Absolutely. That test doesn't exist, unfortunately, at the moment. What we can do is test the B3 and the metabolites, and you can supplement NAD. So we've actually been using NAD for inflammation disease as a nasal spray because it gets penetration, it gets absorbed well. So I think, as a caveat to think of take-home message tonight, if I was having any issues with miscarriages and pregnancy, I'd absolutely want to get on some NAD nasal spray. I'd go straight to the active metabolite. For you ladies who've been trying to fall pregnant, you've probably done your homework and a lot of the plethora of information and trials out there on active folates called methyl tetrahydrofolate. They are equally as important in pregnancy. Okay, what else is important in pregnancy? You need to know your glucose and your glucose stability. You need to know if you've got any tummy issues, are you nutrient deficient? And you need to check your levels and rectify these deficiencies before you fall pregnant. Because often rectifying a deficiency, the doses we use might be 5 or 10 times more than the average standard dose you use when you are pregnant. Okay, what else we want to do in pregnancy? It's a multifaceted disorder. So you look at everything. You look at your inflammation, you look at overall nutrient deficiencies, and look at your diet. And it's got to be a whole food diet. Okay, I hope this has helped. I love the trial. I love research done in Australia, and this is some wonderful research done in nutrients and what a powerful effect they can have on reducing miscarriages in pregnancy. I'd also like to say, as the Compounding Lab, our chosen beneficiary for next year is the Common Good, which goes to research at the Prince Charles Hospital. This is a charity we want to support because it's about doing local research in Australia, and that's really important in many areas of inflammation and disease management. If you want some more information, please jump on Facebook and ask us now. Think of your B3 if you're thinking of falling pregnant. Ciao.